Welcome to the Gifford Provider Podcast. This is the podcast of Gifford Healthcare based in Randolph, Vermont. I'm Scott Fleischman. Gifford is a nonprofit critical access hospital and federally qualified health center with a total of 9 locations throughout central Vermont and the Upper Valley. Gifford's main campus in Randolph is home to a 24-hour emergency department, inpatient and rehabilitation units, a renowned birthing center, an accredited cancer program, advanced diagnostic imaging, surgery, and much more. Go to giffordhealthcare.org to find the services we provide, the locations of our clinics, and all the latest healthcare information, including blogs and our latest news. So with 2022 coming to a close, I wanted to put the focus into the great work that our emergency department and EDs really from all around the country are doing right now, nearly 3 years of chaos brought on by the pandemic. So this month's guest, please welcome Christina Harlow. Christina is an ED provider and coordinator at Gifford. She has a Doctor of Nurse Practicing degree, is board certified by the American Nurses Credentialing Center, and a member of the American Nursing Association. Before we get into our conversation, if you're watching us on YouTube, don't forget to click the subscribe button, like this video, tap the notification bell. That way you'll always know when we have new content for you to watch. On our YouTube page, we have other podcasts, health information from our medical team, videos depicting the culture at Gifford, as well as testimonials from patients and employees. You can also listen to the Gifford Provider Podcast on Spotify, Google, Amazon, and Apple Podcasts. So if you're in the car, out for a walk, go find us on one of those podcast platforms. Do a search for the Gifford Provider Podcast. Follow the podcast. Give it a great review. Share it with your friends because your feedback helps the podcast grow to a larger audience. All right, now that that's all out of the way, Christina Harlow, thanks again for joining us today.
Hi, Scott. Thank you so much for having me.
So reading a little bit on your bio, you are a Wisconsin native, grew up in the
I
Midwest.
am. Yeah, cheesehead. So I wore a yellow shirt, So, yep.
Yeah.
I grew up in Wisconsin. Haven't lived there, though, actually, since graduating high school. So, but yeah.
And your first career was as a mountain bike guide and a river guide in Utah and West Virginia. That must have been pretty cool.
That is correct. I spent many, probably too many, but many enjoyable years. Actually, 10 years of mountain bike guiding in Utah. I was a river guide for just a couple of years. And actually, that's sort of how I got into medicine. Mountain biking is really fun and feels glamorous until it's not. And so when you realize someday that you might want to buy a house and someday you, would like to work year round instead of just seasonally. So things change a little bit. And I actually worked as a mountain bike guide going through nursing school. I got a bachelor's in nursing in Grand Junction, Colorado. And also during that time, I lost my brother, and that really inspired me to go into medicine a lot. So
how important was outdoor life? How important was that to you growing up, being in the outdoors?
Yeah. So growing up, I was raised in the country in Wisconsin, raised without a television, and we spent a lot of time camping and swimming. And I rode my bike all the time, nonstop, rode to school, rode to the pool, rode around the neighborhood, and didn't really get into mountain biking until 18 or 19 years old or so, but rode my bike all the time. Early on, I thought I would be a professional roller skater. I spent a lot of time doing that too, but that didn't pan out for me so well. And so as my parents really instilled that in me, spending a lot of time in nature, and then that brought me obviously to guiding and being outdoors, and it still is a huge part of my life, actually. I don't know if you know this about me, Scott, but I have a pretty big interest in forest bathing, which is doesn't sound like a thing, but it really is. It's a Japanese art called Shinrin-yoku, and it is it's basically immersion into the woods. So you use all 5 senses. It is there's lots of studies that have been done on this, and I've been funded for this to study this at UVM, and there's many books, and so what I hadn't planned on talking about this at all, but it is an really interesting thing and really ties my whole life together. But there's building evidence on how being in nature will decrease your blood pressure, decrease your heart rate. It decreases stress, cortisol levels. There's actually several studies that have looked at this, and I was really interested in looking at how it decreases our stress and our depression and anxiety. And through the pandemic, there has obviously been so much fear and angst and burnout, frankly, among healthcare providers, that I looked at this with a good friend of mine in nursing students, and we measured pre anxiety and depression and some of these, different measurements that way, and then post after a forest bathing experience. And there was certainly some improvement. So it's a really interesting thing, and it definitely needs more research, but it's a cool thing. And so, yes, so in a very roundabout way, to answer your question, nature was important to me as a child, as a younger adult, and even now in my life, it continues to be a very important thing.
That's really cool, actually. It's funny because if you go take a walk through the woods compared to taking a walk on the sidewalk next to a busy street.
Absolutely. And so just a very, very quick tutorial, if you will, on forest bathing for anybody that would like to know more about this. Some of the basic rules are no cell phones, no distractions, and you focus individually on the five senses. So you will go into the woods and you will first notice, what do I see? And you will pay very close attention to the things that you see. And then spend several minutes with your eyes closed. What do I hear? Actually touching the bark, touching leaves, really getting in there. And a lot of people will go barefoot. In the summer, I will do barefoot forest bathing walks as well. And whenever I take people forest bathing, I will often bring a locally sourced tea, so you can sort of taste as well. So I'm not sure I would recommend tasting things around unless you know what you're doing. Don't go and pick the mushrooms, but there are certain ways that you can also taste. And then certainly the smell of the forest, especially after rain or early in the morning, can be pretty powerful. Speaking of smell, that's one of the healing properties actually of the forest. The phytoncides, right, is the essences of the trees. And a lot of the research has been done looking at how that impacts the immune system in the body. And so there's actually evidence that smelling specific forest essences increases your NK, your killer cells, basically. So it boosts your immune system. And so specifically cypress is one that's been most looked at because there's a lot of cypress trees in Japan, and most of the studies have been done over there. But yeah, even smelling the woods, being out there for a minimum of 20 minutes will potentially give you an immune boost, which is a nice thing. We all need that this time of year. So
you could do 45 minutes just on
forest bathing. I know, on forest bathing.
I know, I'm fascinated by this. I mean, obviously I don't know much to the extent, but I do know that in therapy, I'm told, when I feel stressed out in a situation, or if there's something, that I just go out and go into nature and study something. Just look at, you don't have to look around, just focus on one thing and just take in the details of it. And it'll just help you kind of snap out of it and find some balance.
Yeah, it's a meditation, right? It's a form of meditation. Yeah. Absolutely.
So going back now to your life as the guide, and you mentioned this, and I want to go into a little bit more, and we just talked about mental health. Your brother, losing your brother to mental illness, and maybe go a little bit more into that and how that really impacted you, if you can.
Sure. Absolutely. So, that was truly the impetus. I joke and say financially it made sense for me to get a better job, but really the impetus for me and medicine was my brother. And so my brother's name is Scott, and at 21 years old, we lost him to suicide. I don't like to say committed suicide; it just feels like that's a crime, and it's no crime to have depression, So, but he had really severe depression. He was diagnosed bipolar, and we were very close. We were 4 years apart, but we were very, very close. And he actually went on many adventures with me. We spent a lot of time in West Virginia together and Utah, and life got to be just too painful for him. And so, yeah, at age 21, we lost him. And I remember really being so sad because I was like, what if I knew more? What if I knew more about medicine? What if I knew how to help him more? And that really inspired me to go to nursing school. And my very first job as an RN was in an inpatient psychiatric hospital. So I went into psychiatric nursing, and I also pretty early on in my nursing career, I started teaching, and I taught psychiatric nursing to undergrad students in Colorado. And so I really wanted to not only learn more, but also hopefully make a difference in somebody else's life so that they had a potentially a different outcome. So that was truly what inspired me. I've been doing it for a long time now, since I'm now 22, you can tell. No, I'm just kidding. But doing it, and I feel like it is, my thoughts about it are still really the same. I feel like I still want to be able to have an impact on someone in crisis. And so the ER really fits that well. That is unfortunately a place where many people do present in crisis, and we want to do the best that we can for them, of course. And so, I did primary care here at Gifford for 5 years as well. And I love that aspect of helping people that are having more long-term management of their mental health issues and things. But in the ER, it's certainly a different perspective.
And this is something we're going to get into a little bit later about when to go to the ER. But mental illness is one of those things that if you're having a mental episode, the ER is a place that you want to go.
Absolutely. I wish the ER in general, and I don't mean the Gifford ER, in general across the country, this is actually a really growing problem, because we have more and more people in crisis related to the pandemic and feeling isolated. Substance use disorders have grown. People are using more substances than they used to, and at younger ages. And the ER right now is the catchment for people. We are the safe place. We can keep you safe, but it is not the most therapeutic environment if you've been there, And so that's one thing. Actually, the state of Vermont is working really hard right now on trying to figure out how that we can best take care of people who are presenting to the ERs in crisis. We actually meet more than monthly as a group of ER directors and the state to try to solve this issue. And it is not something that affects just Gifford; it's statewide. But we trying to find places for people to get help that they're not in the ER for multiple days on end. Actually, at Gifford, something that we've just done is we now have a telepsych program in the ER. So we have our wonderful social workers. We have a really great behavioral health department. But when they're not available to us nights and weekends, we have telehealth. So we have a psychiatrist who will see the patients via telemedicine system. And it's pretty amazing that we have that ability. And then we also work closely, of course, with our local psychiatric providers, too. So
find a work-life balance at Gifford Healthcare in Randolph, Vermont.
I really found my passion in here, not just because I get to take care of patients, but because of the people I work with. They truly value who I am as a person.
Join a team committed to delivering high-quality care.
Throughout my career, I've found a passion for teaching and was given that opportunity to do that here at Gifford.
A progressive, community-focused organization.
We all work together for one common goal, and every voice matters.
Call or visit our website to apply today.
So tell us how you ended up in Vermont at Gifford. I know it has a lot to do with your husband.
Yeah. So I actually met my husband, Nat, who is a physician. I met him at a barn dance in Colorado. And I'm not sure I should tell this story online, but I was actually on a date with somebody else and he was there. And we had a couple mutual friends actually. And I wrote my phone number on his hand at this dance. And he was a resident. I was working as an RN. He was a resident and he was I think he was finishing his first year. He was just starting his second year as a family practice resident, actually, in Grand Junction, Colorado. Anyhow, the person that I was with, it was, very short lived. Nat called me and the rest is history. He's also a very outdoorsy person. We went rock climbing on our first, second, third, fourth, 100th date. We went rock climbing on our honeymoon, so that's sort of who we have been as a couple. And he finished his residency. I was still working as a nurse. And then he took a job actually in rural emergency medicine in Southern Colorado. And I went to grad school at that time and worked in emergency medicine as well in a different hospital. He did that for 3 years and then decided he wanted to do sports medicine. And so he did a fellowship in sports medicine. We moved back to Grand Junction. I, at that time, was a nurse practitioner and started working in emergency medicine in Grand Junction. And then this is a long story, I'm sorry, but to shorten it a little.
It's a podcast. We like long stories.
And then his family, he's from Vermont. So he grew up just outside of Burlington and he really wanted to be close to his dad. His dad is his only surviving parent. And he's also older than my parents. And so we wanted to be close to his dad. And he wanted to work in rural sports medicine, which is extremely rare. That doesn't happen. It's like a big city thing, big sports teams, big hospitals, et cetera. So, but Gifford, as you well know, has a rural sports medicine program. And so Nat came and worked in the Sharon Health Center for 5 years. While he was there, he decided that he loved doing procedures and he thought he could help so many more people by learning more interventional medicine. And so he went and did interventional pain medicine fellowship. So that's 3 fellowships, which I have been patiently waiting. No, 2 fellowships and a residency, patiently hanging on for. No. And so he's now doing that. So that is what brought us to Vermont. And I have been at Gifford the entire time for almost 9 years. So
9 years here. What is it about Gifford that stands out to you? Now you've been in different departments, working in primary, and now we're working in the ED.
Yeah, I'm a lifer. I'm a Gifford lifer. There is something special. I love the people that I work with, right? Like that is the most important part of the job. I love the people I work with. I feel that it's a really unique place, specifically in the ER, because while we're rural and critical access, we have a ton of resources, which is not very common. So we have anesthesia 24/7. We have general surgery 24/7. We have all of these specialists that makes us a really unique and well-resourced place to be. We also have a really great team of people in the entire hospital, but I think the ER is pretty special. All of the providers that I work with, Josh, our CMO, is really incredible, really supportive. And I feel like we try across departments, everyone tries to work well together. There's good communication. I love the patient population here. I love seeing patients that I used to take care of in primary care. And now they come to the ER and, we still know each other and our whole family history. So it's, Scott, it's hard to really say exactly what it is about Gifford, but it's special. I feel as a provider, I feel valued here. I feel supported. And I guess it was really evident to me through COVID when everybody was so scared and so worried, and it felt very prepared. We felt like we had what we needed. We had some cases that were hard and tough, and like everybody did, but overall we got through. And I think it was because of the preparation and the support of administration, and we got through it. So I feel really, really, really lucky to be here.
Did you make the move from primary to the ED before the pandemic?
Yeah. So I've been in the ER, I think about 3 years. So it was pre-pandemic. Yeah.
But not too far before.
No, not too far. Mm-mm.
How much of a toll did the pandemic take on this emergency department here at Gifford? And I know in the beginning, the summer of 2020, I remember Vermont's numbers were very low. People were and we didn't hear a lot about hospitalizations until we got further into the pandemic. So I imagine for the first part, it wasn't, the precautions were taken, but it wasn't as bad as we all feared. And then it probably did get as bad as we feared.
Maybe my perspective is different, but I don't ever feel that it got as bad as we feared, because we feared pretty bad.
Yeah, that's true.
It felt like and I think I've heard Josh use this description too, but it felt like we were all waiting for this huge tsunami wave that never actually came to us. Yeah, we had really sick people. We had COVID. We had COVID deaths in our hospital. We had really, really, really busy emergency room. We still, our numbers still, even post-pandemic, are up almost 20% more than they were pre-pandemic. So our ER is really busy. And so that might lead to our next conversation, is just when to come to the ER. But I feel like we still are able to stay afloat, right? Like we have, and I think that a lot of that has to do with how well we work across departments. The hospitalists will come up and help us when we're drowning. We'll bring in more nurses. We have the ability to sort of maneuver and float and sort of like make it work. And yeah, there are some days that are really, really tough and really bad. But for the most part, I mean, that's typical emergency medicine. For the most part, we don't have people waiting 8 hours in the waiting room to be seen. We 2 or 3 hours maybe, but not like it is in other places. So we are somehow protected by this cloud of good luck, I guess, and also a good dose of preparation. I feel like we've tried really hard to be prepared. So,
what are some of the cases that you're seeing right now?
Right now, we're seeing a lot of flu, a lot of RSV, and a couple of cases of COVID still. We do have pretty high vaccination rates in this region. And so the people that are coming in with COVID tend to not be super ill, which is really great to see. And so and then just upper respiratory stuff, the common colds and things, and but a lot of flu right now. I just, before this meeting, I looked at the flu rates in Vermont, and they're certainly going up, 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 up. Mostly all influenza A. There's 2 strains of influenza A. One of them is the H1N1, the avian flu, but that's like 20% of the cases. The rest of them are all the other influenza A. And it does look like the vaccine is fairly effective this year. We won't know until the end of this season, but I do want to give a plug for getting the flu vaccine, because most of the people that I've seen that are really critically ill with the flu have not been vaccinated this year. And the ones that are still getting it but have been vaccinated tend to have a really short illness and do fairly well. So it's not too late. You can still get your flu shot this year.
Yeah, you took the words right out of my mouth. Not too late to get the flu shot.
Yeah.
Being able to work in a hospital, being paid a decent wage, being able to be in a really harmonic environment with your work and then leave and be in the countryside, it's stunning.
More than 100 years of high-quality healthcare to Vermonters.
Never really had the opportunity to branch out into another modality. Took the position here with Gifford offering to train me. Everything here supports you to become a better version of yourself.
Learn more and apply at giffordhealthcare.org/careers.
Are we still seeing a high number of people? Are we still seeing more people in the ER now than in years past, maybe pre-pandemic?
Yeah, so it's interesting. In the last couple of weeks, our numbers have dipped, but just until, which is interesting with the flu season, but our overall numbers have been up about 20%. than what they were before.
A lot of what we're seeing right now is people going to the ER. I think that's just their natural response. If there's something bothering them, just go to the ER. And right now that's causing an issue with our ERs being overcrowded. And so let's talk about, when is it necessary to go to the ER? We talked a little earlier about mental health episodes. How about some other cases?
Yeah. So, of course, mental health, I want to make sure that anyone always feels comfortable presenting to the emergency room if they're having any mental health concerns, of course. So I also want to say that I think some people are coming to the emergency room because the primary care is so backed up that they're not getting in as quickly as they traditionally could. And then they're becoming sicker and they're out of their medications. And so that is one issue. And so I know that at Gifford, the primary care team is working really hard on this and trying to increase their visits. But that is one thing. And and if you're not able to access care, it's true. The emergency room, that is what we are there for, And so, of course, I don't want anybody to ever feel that they can't go to the ER if they feel like they should. However, there are lots of times where you have an illness that you may have historically, I might have the flu. Maybe I should go and get checked. Maybe I should go and see if I have the flu. If you are under 2 or over 65, or you have any chronic conditions that would make you more likely to become really ill from the flu, it is really important to get checked out to make sure that your vital signs are okay, that you don't have a pneumonia. But if you're at an age in your age, say 5 to 60, and you're otherwise healthy and you don't have severe asthma, you don't have diabetes, you didn't just have a heart attack a week ago, and you have a fever, it's okay to stay home. It's okay to take medication for that. And if you don't feel well, I highly recommend things like Tylenol and ibuprofen and lots of fluids and rest, and let your body rest. If you're really short of breath, you should get checked out. If you feel that you have an emergency, please, by all means, come in. But there are a lot of cases where you have an illness and it will run its course and you will do okay. There are some people who really would like the antivirals too. And so, antivirals are certainly a treatment for the flu. The evidence doesn't really support that they're great in those healthy people. They're best served in people who have underlying illnesses, or if you're over 65, under 2, if you're pregnant, those types of patients are the ones that are going to benefit the most from an antiviral. It's not that you can't have it, of course, if you feel like you would benefit from it, but it's just not going to be as effective for that population. And the other thing is it doesn't prevent the illness. It can shorten the duration, but there's also the severe side effects that sometimes go along with it, of nausea and diarrhea, belly pain. So there can certainly be some double-edged sword with that, especially if you don't really have any other problems. So,
what about the emergency department in comparison to urgent care?
Yeah, that's a good question. So the urgent cares are as busy as we are, but they have pretty much the same resources. The emergency rooms are probably better for trauma, chest pain, those types of things where we can, or if, you would need to be admitted to the hospital, et cetera. But urgent cares are very well equipped to treat the flu and RSV and COVID and all of those things that we're seeing a lot of still. And they're good for minor wounds as well. If you have a little cut on your finger, urgent care is great for those types of things. We don't have an urgent care right in Randolph, although Gifford does have a Saturday clinic. So Saturdays we do have our own urgent care. It is by appointment, but it's basically same day appointments. So that does actually help quite a bit for the ER here.
And then that was one of the things I was going to ask. Being in a rural area, I guess that's easier said than done to just, and I can imagine Gifford's not the only hospital in that situation, and a rural hospital in that situation where there may not be a lot of options.
Right. Yeah. So, anybody that lives here, depending on where you live in the catchment area, driving 20, 30 minutes to an urgent care, where if the ER is 5 minutes away, it just, is whether somebody will choose, especially in bad weather, inclement conditions. So
I also want to put a plug in for sexual assault cases too. Those cases should also report to the ED. We have nurses here now, specially trained to help those folks who have been affected by any sexual abuse cases. So again, that's something else that you want to go to the ER for.
Yeah, I'm so glad you brought that up, Scott. That's true. So, and actually, until recently, we did not have the ability in our ER. We, whenever we had a sexual assault case, we would frequently send them to a different facility, just because we weren't able to manage them appropriately. But now Gifford does have an entire team of people dedicated to treating those appropriately. So, yep, absolutely.
And that's such a tough thing. It's tough enough for someone to come forward and go to an ER, but then to be turned away and say, no, you have to go somewhere else. So to be able for Gifford to offer that service again, it's a pretty good thing.
Absolutely. Like I said earlier, we are a small critical access hospital with a lot of resources, and it's pretty cool. One more resource I wanted to just bring up too is this geriatric emergency department that I was mentioning earlier. And what this means essentially is that we are building into our EMR and to some of our processes, these basically safety nets for anybody over 65. So we're screening for falls. We're making sure that we are discharging or having appropriate follow-up. So much higher level of suspicion, essentially, for somebody who has mobility issues, and finding the appropriate referral process. So we have physical therapy, both in hospital, outpatient. And then we're working with the Dartmouth geriatric team, where they have a pharmacist who will review our medications. We have social worker now that's going to be embedded in the ER, which is really amazing and special. And so social work will be able to really help make sure that these patients are not going home and falling and then having a worse outcome. So it's a lot of work, but it's going to be pretty great when we're all said and done.
I didn't ask you this, but why, you did mention a little bit, but maybe go in a little more depth about why you did move from primary to the ED in the first place.
Yeah. So like I said, I appreciate taking care of the patient that's in crisis, but truly I think it's more a personality thing. So I was an emergency room nurse, and then my very first job, like I said, as an NP, was in an emergency department. And then I really appreciated being in primary care, and it was great for my schedule and my family, and I learned a lot. But it's sort of kind of a joke, kind of true, actually, when in the emergency room, my job is, okay, you're not dying. I think you're going to be okay. You have some chronic stuff that I don't know what to do with, so go to primary care. And then I would get these patients from the ER and primary care, and I'd be like, wait, I have to figure all of this out. So I appreciate the short-term acute issues that I can actually make a big difference in the moment, and that's just, I think it's just a style. It's a personality thing more than anything, but I do really like the emergency room.
You are you have your doctorate in the field of nursing. Gifford, small rural hospital, like many rural hospitals across the country, really rely on advanced practice providers, nurse practitioners, physician assistants. Explain why that is. I mean, for first step is shortage of providers, correct?
That's primarily it is, I was having this conversation recently with Nat about how, some data has come out recently that people will practice in places that they've grown up in most commonly, right? And where they've also trained. And so a lot of physicians are training in these very large medical, academic centers, and they have access to a lot of resources and a lot of other specialists. And it's, they have a whole team of people that go and treat patients. And then, so leaving that type of a setting where you've trained and going to a place where you're the only person there is really scary. And so I think that's part of it. The other thing is financially, it's different as well. A critical access hospital can't compete with some of those large academic centers for salaries for physicians. And so I think that it's sort of a multifaceted reason why we have a lot of the APPs, or the advanced practice providers at Gifford. But we also have, we have UVM close by, which has a doctorate, a DNP, so Doctorate of Nursing Practice program there. We've recruited several people from that program. And I myself, as well as many other providers here, both physician and non-physician providers, have had them as students. And so they come and they're here as a student, and they get to understand Gifford and fall in love with it there. And then they want to work here. And so I think, like I said before, a lot of it has to do with sort of what your clinical experience is and what you become accustomed to. There's also a great PA program in the region. And so we've recruited a lot of PAs from that program. So I think it's financial. I think it's where you're from and what you're used to. And I think it's also the working environment, so the DNP program at UVM is considered a rural medicine program. And so so it's an easy transition to another rural area. And we have an interesting setup at Gifford where there are really great physicians who will sort of take the APP under their wing and help sort of guide them, especially if they're a new graduate and in primary care. And so it's a really supportive environment where you don't always get. The ER is a little unusual. There's myself, and then we have a PA, but we are the only two. Everybody else in the group is board certified in emergency medicine. And in rural areas, it's either all APPs or a mishmash of, family practice physicians, APPs. So it's unusual to have as many board certified emergency physicians in a rural ED that we do. So we're really lucky. And I feel like the team that I am in, we're very collegial. Lots and lots of back and forth about what would you do with this? What would you do with this? So it's, again, like I said before, it's a really great environment. But I love that we do have, as being an APP, I love having them along with me and the team, right? And so we have really great providers in our behavioral health, our midwives, hospitalists, there's lots of different sections of the hospital that Gifford is utilizing the advanced practice provider. And I think it works really well for us. So,
and I think you mentioned something, touched on it briefly, about being in the community, and a lot of the APPs that are here or around are, pretty much grew up in these types of areas, know the folks in these areas. So as a patient to come in, being a patient who lives in a rural community, to see somebody helping them who's also a part of that rural community or grew up in that, it seems like there's there's a connection there.
Absolutely. And such a layer of trust, and multi-generational layers of families in this community. And I think that really, really helps a lot too. Knowledge of medicine is, of course, extremely important, but the relationship that you build with your patients is arguably more important, because they're going to share more information with you. You have a much better understanding of all of the components that make their health what it is, and so I do think that nurse practitioners are trained under a nursing model, which is very relationship based. And I feel like that kind of a background and education really does help facilitate those relationships in a rural area. So.
Well, very informational talk today, Christina. Learning a lot about you too that I didn't know. And
better or worse, Scott?
No, some good stuff. And I think we can take away a lot about right now we've got our overcrowding in our EDs, and I think it's always a good reminder to know when to stay home.
If everybody would just consider for a moment, okay, if I go to the ER, I'm very likely going to be exposed to COVID and or flu and or RSV. Is that a risk I'm willing to take? And so that is just one thing to consider, So if you are feeling pretty well, but you think maybe you should just get a test, just consider that you possibly are exposing yourself or your child. As much as we try to prevent infections and spread of infections, it's a small ER. So just something else to consider.
No, that's a great point. Christina Harlow, great talking to you. Thank you very much for joining us again. If you're seeing this interview on YouTube, before you click off of it, subscribe, tap the notification bell. That way, every time we drop a video, you'll know it. And leave a like on this video as well. Share it with your friends. And again, if you're listening to the audio version of this podcast, subscribe to it, share, leave a great comment, because then more people can hear some of the important information that we're giving out on these podcasts. So for the Gifford Provider Podcast, I'm Scott Fleischman. We will see you next month.